If you like being able to watch the podcast, make sure to let me know by subscribing to this channel. Everything is working out for me. It's working out for you, too. It just takes believing that it is. We can have, be, and do anything. The key is to care about how you feel and choose to feel good right now. I'm here today with Dr. Belinda Bellet, and she is a clinical psychologist. She is the director and founder of BHBA, which stands for Brooklyn Heights Behavioral Associates. Belinda, I'm really happy that you could be here with me today and be on the show. Thanks for coming on.
Thank you for having me. It's quite a pleasure and a privilege.
Can you just give the audience an idea of what your background is in psychology and what is the area of focus in your practice?
Sure, absolutely. I'm I guess what you would call a seasoned practitioner. I've been practicing for about 25 years. So I trained in New York City. I live in New York City. I work in New York City. My practice currently is in Brooklyn. It's a private practice, and we specialize in what's called evidence-based treatments, which is these are behaviorally based in science.
Backed by research kind of things.
Yeah, backed by research, for lots of problems, and because they're specialized treatments, they're often targeting bigger problems like. I've been a specialist in what's called dialectical behavioral therapy, which you mentioned. That's a specialty that's been around since the early 90s. Dr. Marsha Linehan developed that, and that's specifically to treat people with suicidal problems. It's been generalized to lots of different populations, and certainly throughout the age range. So like youngsters, unfortunately, have that sometimes, and then through elderly people. And then we also specialize in other behavioral treatments, but that's my specialty. And in particular, parent coaching. I do a lot of family interventions, parenting interventions. I do that mostly every day.
I was reading your bio and it was showing me that you have a lot of study time on kids with dialectical behavioral therapy, but you don't actually work with that population now, but your practice does. You kind of have this integrated kind of approach at your
I do.
practice. Yeah.
I do. I treat kids through parenting work.
Okay.
And front and center are child's symptoms.
Are you teaching the parents
Yes.
the methods of dialectical behavioral therapy?
I'm teaching the parents distress tolerance skills, which is what I find to be one of the biggest problems is the child's distress triggers the parent's distress. And the parenting response is not as effective as it should be because,
You're in a stressed state. Yeah, that makes sense.
Yeah, it does make sense. It's biological. We're wired to respond in these ways. So, D.B.T is designed to help with emotional and behavioral and cognitive dysregulation, severe emotional, behavioral, and cognitive dysregulation. So we can get it in all three realms.
Yeah.
And when you plug in as many alternative ways of managing, your own spike urges to respond, right, or emotions or thoughts, right, we can work with you. If I can get parents to, respond more mindfully and, more effectively. And then I also teach behavioral parenting strategies that are effective. Or there are a lot of parenting behaviors that aren't effective that we, maybe are just going on instinct. Or maybe they work perfectly fine for one child, but not another child because of temperament or trauma or, other factors. Cognitive impairments, you name it. It could be lots of things contributing. Their instincts aren't working anymore. They come for help for themselves, but there are other handful of parents come into the practice where the kids' symptoms are so bad that they wind up in the pediatrician's office or in the emergency room or in the school counselor's office, showing self-harming wounds or, telling their friends they're going to kill themselves, right? And so that gets the family into treatment.
Yeah.
But by then, most parents are like, I'll do anything, just, help. So teach basic behaviorism in terms of increasing the likelihood that your kids are going to be responsive to you, right? To get what you want. Bring in values, family values as a roadmap for the family to behave under that umbrella.
Mm-hmm.
And teach parents distress tolerance skills to manage their distress so that then they can use effective parenting skills.
How successful is this? What kind of success rate are you seeing specifically with your practice?
Well, for the most, I've doing this 25 years. I talk to my team about this a lot. Like, I have longevity because it is effective treatment.
Yeah.
I'm able to do this without getting burnt out myself because I get results. And, results aren't everybody's cured. Results are, okay, you started there and now you're here.
It's improvement.
It's improvement.
Yeah.
You're decreasing the frequency of ineffective behaviors in yourself, which it's because everything's transactional, will have an impact on the child's responses, right? So we want to decrease the frequency of their behaviors. Also modeling, if you're not yelling and you're telling your child not to yell, you're going to have
Yeah.
a better likely, outcome there. So it's all transactional and intermixed, and if everybody sticks with it, like, that's hard, right? And then parents get discouraged because they're like, oh, well, the kid behaved the same way, or I did the same thing I did last week, even though we had this whole plan and I was committed and I did it anyway. But you just don't give up. That's how people get better. They just keep at it, and every day is a new day.
It's easy to fall back into those family patterns. There's a
Well,
dynamic
because they're
there.
habits.
Yes,
They're habits
absolutely.
of relating.
So are other people in your practice, other clinicians there, they're working with the kids? Is this like you
Yes.
guys are able to talk about this in team meetings? Like this is a
Yes, we do. We have
full,
weekly team meetings. Yeah, we have
okay.
weekly team meetings, and
So
then
this is full integration where you guys are discussing this family and all the
mhm,
different dynamics. I love that so much. When I
mhm,
worked with kids, that was the biggest struggle that I had was the parents were not involved and
I
they
know.
would drop off their kids and they'd go fix my kid. My kid is a problem. And I didn't see the problem in the kid because the kid's a totally different kid there in the
Mm,
therapist's office, right?
mhm.
Because
Sure.
the home
Parents are
environment,
totally different parents when they're not with their
that's
kids
true
too.
too. Yes.
Yeah.
But
And
what I found was that the parents really didn't want to interact. They didn't want
mm,
to change anything from their side. They just wanted me
right,
to they saw their kid as the
right.
problem and wanted me to fix them.
Well, and sadly, it can take problems of extreme nature to get parents
Like
into
suicide.
into treatment and agree to these things. I
Yeah.
see parents, though, across the spectrum who, are completely involved. Sometimes this really is, parents are really invested. I mean, my team says the same thing you said, and I also experienced that myself. Like, we definitely have parents who really don't, they feel they've done enough, or they
Yeah.
don't,
Well, they're
they
probably
don't
burnt out and they just want someone else to take it over.
right. But also parents who really do get involved, and
Yeah.
those families do have the best outcomes when child's motivated, when parents are motivated, everybody's. And there's also a skills class that everybody's in weekly. That's parents
Yes.
and
Okay.
child, so they're all learning the same skills. With any treatment for kids, psychologically based treatment for kids, when parents are involved and motivation is high and everybody's working together on behalf of the child's symptoms, the outcomes are better.
You touched on something really important, I think, because buy-in is one of those things they teach you when you're in school and you're learning to become a therapist. They're like, you have to get the client to buy in, right? Buy into the
Hmm.
treatment.
Yeah,
It's an investment. And once
it
they
really
are
is.
invested, they do make the changes because they want to make the changes. And I want to
Right.
touch on what else you said about not getting burnt out because
Hmm.
that's something that's huge in this field.
Yeah, it
Therapists
is.
burn out because there's a lot of negativity that comes with this job. And if you take it on, it manifests in a lot of ways in our body and our
Sure.
own mental health and things like that.
Sure. One of the things that I champion is mental health workers and also frontline workers, first responders.
Okay.
I've been involved with that in New York City for many years, since the beginning, really, because I was here during 9/11 as a psychologist. So I worked with firemen and Red Cross and the medical examiner's office.
Well, that was deep.
And then I've worked with first responders during COVID,
Yeah.
nurses,
Wow.
hospital staff.
Well, what is your
Yeah.
advice? What is your advice to therapists to not get burned out? For you, you said there's a high success rate in this treatment, and that helps you to not get
Right.
burnt out.
It does. And
Yeah.
relying on the treatment, also relying on my team. So you need support. You really need support. So I think solo practitioners out there have a hard time. I remember when I was a solo practitioner, I really felt isolated.
Yeah.
And even, after I didn't need supervision anymore because I was licensed, I would just check in with my supervisor, because it was somebody to talk to.
Yes.
And, this isn't stuff that you can go home and talk to your spouse or talk to your
Right.
partner or talk to your friends. This isn't dinner party conversation. And then after, a long day, you don't want to sit at dinner and, talk about, some people might, but I certainly don't feel like it.
Yeah.
I just want to hear about other people's days. So kind of just like decompress.
Yes.
And so, but to find communities, so networking groups or peer supervision groups, I think are critical. Even if, you don't need a supervisor, get one anyway.
Yeah.
You know, I started some networking events. So like I just invited a bunch of when I was networking to build my business, I would have neighborhood luncheons with different practitioners that I would meet, and also cross like
Communicate.
professions. So like with psychiatrists, with school counselors, with
Pediatricians. And
pediatricians, I would try to really, but in person. Now everybody wants to meet remotely. I miss the
I
days where
know.
I had my networking coffees. But you
Yeah.
can still do it, and I think I think we should.
What about energetically speaking? I know for me, what
Mm-hmm,
I know now, if I were to go into practice again, I would really protect my energy just
mm-hmm,
with some really kind of
yeah,
woo-woo things
mm-hmm,
like imagining a barrier around me and
mm-hmm,
brushing off the session into the
right.
ground, some grounding, things like that.
Yeah, yeah, absolutely. Um, I and I think everybody's different. Like
Yeah.
I I've always been the kind of person who ran towards the fire.
I'm here
you
to
know?
help.
Yeah. Like just like I've always imagined that moment on the plane when the doctor comes up, when someone's having a heart attack, but instead they're having a panic attack. And I'm like, I'm a psychologist, get out of the way.
If that happens, you have to tell me.
But that's, like I have to
Yeah.
be useful. I can be useful. But no, so in, my first part of training, I've envisioned myself working at, sort of ground zero of mental health and medical health at Bellevue, which is a public hospital in New York City. And that's where I wound up working. I manifested it. I was like, I will
Yes.
work at Bellevue. That's where I cut my teeth in my training. And I forced myself into the internship rotations that were in the psych emergency room. So I was in the psychiatric emergency room working with adult, intent,
So
like
in really
very
chaotic
seriously.
environments, you work really well. I mean, in a
I do.
chaotic environment, you're focused and
I
you know
do.
what to
And
do.
I feel very capable in those
Yeah.
experiences. And I think I know I have some, trauma and chaotic childhood experiences, but, which crumbles some people. But I actually have a lot of capability around. I
You
did
thrive.
get treatment in my 30s for trauma because it caught up to me. And
Okay.
I needed that. And I still do trauma work when I need it. Stays in your body. So,
Sure.
but you just have to know what you need. And I do a ton of self talk, and things like, to to cultivate internal safety and relaxing. Like if I notice tension, I do this. It's like mindful reading. You know those things now, they have those bio trackers that you put them on your skin and you can see how your blood sugars are. Well, I do that with my mind, with my tension and my mood.
So you check in with yourself.
I check in with myself all the time, and I'm always giving myself what I need. Like if my mind is out of control, I do mindfulness. If my body's tense, I do relaxing. If if I'm having anxiety, I do like my reminders, like anxiety is excitement. I'm excited.
That's a positive spin.
Well, it's the same place in the brain. Anxiety and excitement are so I know how you can reinterpret these things, or deep breathing to get my to regulate my breathing. It's I'll notice, oh wait, I'm tired. I need a nap. I'm going to nap for 20 minutes, or I need a walk. I need to clear my head. I need to tell myself, pat myself on the back because I did a really rocking job this morning and no one else is thanking me. So that's a big thing. Like I've taught my team, you have to thank yourself. People may get better. Don't expect a thank you. They may, and that's not why we do it. But you have to do it to yourself because that's what keeps you motivated,
your cup gets
right?
empty sometimes, and you just need to feel like you can appreciate what you're doing. And sometimes that comes from being appreciated by someone else or yourself.
Right.
Yeah.
And reinforcement is actually a behavioral intervention. Reinforcement increases the likelihood that you're going to do it again.
Mm-hmm.
It increases motivation. Also, it increases internal pride. So all of those give you this warm and fuzzy feeling, and you're lifting yourself up, but you're also making it more likely that you're going to do it again.
Okay, so let's talk about an actual example of that. Let's say that somebody listening really wants to get fit and healthy, but they hate exercising, but they know that that's really what they want to do. That was you? Okay. So what can you do applying what you just said in that situation?
There's a lot of things that make exercise hard for me, and I think people could relate to this. One thing is, it's like as soon as the topic comes up, I think I hate it.
So you think.
Like, it's an automatic thought. I hate it.
Yes. And then you have a manifested feeling of, ugh.
Dread.
Yeah.
As soon as you say, I hate something, or I can't do it, or I can't cope with it, it actually does. It debilitates you a little. It physically and mentally. This is what sports psychologists use to keep their athletes in that grueling, sort of practice phase of their lives, or everything. They just have to keep going and going and going. It's, and also when we go into childbirth, right? We try to remember what we're doing it for, and it becomes much more tolerable than say something else.
Right.
It's so I say I can do it. I can cope with this. And then think about how you're going to feel afterwards. So once the dreaded thing is completed, how are you going to feel once you complete it? Most people say, I'm going to feel really good because it's something that I know I need to do. I hate doing it. When I do it,
I did it.
Check it off. Poof, done. So think about the long-term impact of how you're going to feel, and then reinforce. So there were several ways that I found I needed to reinforce myself. One was I hired first I had to hire someone like a trainer because I knew I wouldn't do it on my own.
Accountability.
Yeah. I picked someone who was a cheerleader. She had that in her nature. And so, there were other coaches who, just had a different style, but she's like, you're a beast. You're an athlete. You're a badass. And it's like, I'm lifting 5, and I'm like, this is hilarious, but this is what I need.
Well, she provided a different dialogue for you.
Yeah. And it was very reinforcing.
Yes.
Very reinforcing. And then I got a bunch of accountability partners. So that was also ways to keep me reinforced, because we were giving each other high fives when we did our, what we accomplished.
So those are other people that are doing the same thing as you.
But reinforcing, each other.
Holding
So
each
again,
other up. Yeah. Okay.
but this is principle reinforcement, right?
Yes.
So reinforce capability, increase your capability by telling yourself you can cope with it. It wasn't dying. This is not imminent death, even though it did feel like it sometimes.
Yeah.
Accountability, reinforcement, and things like scheduling it, putting it in your calendar so that it's not negotiable,
Yes.
or just like
Well, and it reminds
work.
you this has to happen.
Mm-hmm.
And I'm
Yeah.
a big fan of the 30 days that for making a habit a habit. That's big for me personally. If
Mm-hmm.
I can do something for 30 days, I'm pretty invested in it
Yeah.
at that point. So
I think
that's
that's
reinforcement also.
Yeah, and
Yeah.
it does take a while for behavioral change when we're working with kids and they're working on some behavioral change. I always tell parents, like, you can't move on to a new behavior for at least 2 to 3 weeks.
Oh, just stick with one that you want to work
Yep,
on and really work
yep.
on that one. And
Nail
once
it.
you
Give
got
them
it
tons
down,
of reinforcement rewards. Otherwise, it's going to fall off again.
yeah,
If you teach your dog to sit for 3 weeks and then they're like, oh, okay, they should sit. And then 6 months later, you tell the dog to sit. It's not going to work.
right.
Right? I mean, they're going to remember it, but they're not going to get it, and they're not going to do it enthusiastically, and they're not going to do it first time you say it. So you really just have to be consistent with your praise.
And how do you help parents to do that, to be consistent? Do you give them some kind of tool so that they are
Yeah,
checking things off? I mean, once you
yeah,
get home, it's kind of like, oh, my therapy session's out of my mind now.
right. You know what I do? I have the kids get involved in their own reinforcements.
Okay.
I
What's that look
have,
like?
well, I mean, depending on the age, but anything that's shiny, marbly, throw it in a jar. When a kid does a behavior, they can take a marble, throw it in their jar, whatever the behavior is. And as it adds up, the parents are praising, because you got to praise, and hugs and warm high fives and all of it. That's the most important thing. But the marbles add up, and then you get a big reward at the end of the night. Oh my God, like a celebration. And then at the end of the week, something, that's reasonable, that is like a bonus prize.
I really like the visual stimulation that offers also
Mm-hmm.
because you get to see the progress as it's happening.
Right. Right. But you can shape anything. What I use a lot, because a lot of my families are really suffering, what I use is family values for the jar. So, like, anything that kids are doing or engaged in that line up with your family values, they could get a marble. And it just shapes really good citizens in the
Okay, I
home.
like that.
Yeah.
Because, I mean, you mentioned that these families that you're working with, a lot of the time, the focus is suicidal ideation and action. I mean, these kids are taking action, they're cutting, and they're verbalizing how they plan to hurt themselves, and that's really alarming. And when we're talking about a system like marbles, that seems
So here's how it relates.
okay, you see where I'm going with it.
Yeah. People who come to me usually it's that the child or the adult or the teen has big emotions. So toddlers, they're gonna, if they have big emotions when they're little, they're gonna have big emotions when they're big. Even all the DBT in the world, it's not going to change that. And with big emotions come big actions, big words, and they can be threatening, they can be violent,
They get your
right?
attention.
They get your attention, they can be scary,
Mhm.
right? And so, but shaping up your family with family values is, that's the path forward,
Okay.
right?
It really is kind of pivoting your focus. Let's not talk about the suicidal ideation anymore.
Absolutely.
Let's talk about these values that we have.
Well, and when you're engaging in the behaviors that we want to see, that, I know are going to make me happy and make you a better kid and adult, um, you're providing reinforcement and cultivating the things that you want, right? And then making
Right.
those things more likely to happen again. If you're focused on all of the horrible things without cultivating the other, you're providing reinforcement, attention, right? Making it more likely that, they're probably going to do it again. They're getting your attention. And then, but no new direction for the brain, like nothing. You've got to give them a pathway, a different instruction. In behaviorism, we call this positive opposites. So like, stop jumping on the couch should be sit down right now.
Mm.
Right?
Say
You
what
need
you
to tell.
want, not what you don't want.
Exactly.
Mm-hmm.
Exactly. You wouldn't tell the dog, stop not sitting.
Yeah.
Sit down. Very proactive. So you think about what am I reinforcing? What am I cultivating? What am I focused on? And, like the kid, often when a kid's suicidal or an adult suicidal, they don't feel seen.
Mm.
Right. And when you start to be noticed for all of the goodness and all of
Yeah.
the things that you are capable of and all of the things that you are bringing to the world, right? That's a panacea for everything. It's just to be seen, and a lot of people say, well, the kids misbehaved for the last 15 years. I can't think of it. Well, we can think of some things. So we just start small, but what are we cultivating? What are we attending to?
I think you're describing law of attraction in a
Mm,
clinical way,
mm,
because what you focus on is what you get. And you're saying, let's go over
totally.
here and look at the things
100%.
we
What do
want.
you want?
Yes. And stop looking at these things we don't want, because that grows. That focus
Mm-hmm.
manifests into
Sure
more of what you
does.
don't want.
Sure does.
I love
Just like
that.
if I were not paying attention to my mind and I got into a very negative mindset about my work, which, happens. I was feeling stressed out yesterday. I talked to a member of my team. I got support. But if I noticed in my body all this tension and my back and my jaw and my heart's racing a little bit. And I had to do a lot of internal soothing. I
Yes.
used my self-soothing skills. I owe that to myself.
Well, I'm glad you brought it up though, because we were talking about mindfulness, and that's what you're describing. That's really being in the now. And where am I sitting right now in the now? And that's where all your power resides. So I love that you tune
Everything.
in,
Truth
right?
is there.
Yes, right.
The truth is there.
And that's how you know what to do next.
100%.
Yeah.
It tells you everything. Your mind, your body. What I teach parents is, and my team and myself, I use this all the time. What does my mind need? What does my body need? What does this moment require?
I love that.
Yeah. And then you can prioritize. But it's a way, Marsha would call this like a wise mind. What's your wise mind say you need? But this is my way of getting there.
For me, it feels like well-rounded wellness.
Mm-hmm.
You're
Yeah.
addressing each thing so that you can feel fully well.
Right. And emotions. What emotions am I feeling? Emotions
Mhm.
are truth tellers. They if you learn to read them, hear them, listen to them, they're going to tell you what you need.
Yes, that is your guidance. I fully agree with that.
Yeah.
So one thing that you and I really connected on when we talked before this was spirituality. And
Mm-hmm.
my audience knows that when I talk about mental health and mental health practitioners on the podcast, a lot of times I have kind of a jaded view, because I don't believe in diagnosing. I don't believe in focusing on the problem, kind of like what we were talking about,
Mm-hmm.
because that grows and
Yeah.
you get more of the problem. And you and I found out that we have very similar views, which was
Mm-hmm.
really exciting for me to find someone else in the field
Mm-hmm.
that is looking at mental health treatment in that way,
Right.
that spirituality is a piece of that in a really big way.
Mm-hmm.
What's
Yeah.
your take on that?
Marsha Lanahan, who developed D.B.T, I ran across her work when I was in my uh, first year of my internship at Bellevue. And I started working with patients. Her treatment was designed to treat borderline personality disorder, okay? And every single time I ever heard her speak, and it was numerous, she would always mention that she had to do that because she had to get grant for her studies through the
That
National
explains
Institute
so
of Mental
much.
Health. It
Yes.
explains a lot. But this is what a lot of researchers are faced with, right? You
Yes.
have to, where's the diagnosis? But that's not who she, but behavioral science doesn't, we don't, there's no diagnosis in a behavioral science manual, protocol. You're just, what are the behaviors? You have to have one behavior, and you just find interventions to change the behavior using principles of behavioral science.
Yes.
And human behavior is what it is. There's no right or wrong,
And it
right?
changes all the time.
It's fluid. It's, and everybody who ever has one symptom or even like psychosis, it's all part of being human.
Mm-hmm.
And that is embedded in her work. And I'm so loyal to the training. I also have, I follow Thich Nhat Hanh, which is a Buddhist monk, and his work is very much about love and acceptance. And I've just been, shaped by all of that. D.B.T, dialectical stands for two truths at the same time. One is accepting, acceptance is everything, change is everything. You can't have all acceptance without a little change. You can't have all change without acceptance, right? And so, but you can't do both at the same time either.
Hmm.
But you need to have both in your mind. So, but acceptance, I find most parents lean too hard on change. So you've got a whole lot of accepting to do. And, that's the highest form of love, right? Is
Yes.
to accept someone, not because you think you have to, because you're human too and have probably done the same thing somewhere along the lines of your life,
Right.
you know?
Yeah, you can find a place to understand it and therefore accept it. Mm-hmm.
Right.
Yeah.
And not punish it. You don't like it,
Yeah.
but there are a lot of things we don't like. We have to
True.
tolerate that.
Yeah.
It's a big deficit in our world right now. But I think that's a spiritual practice, is to figure out how to love each other.
Yes. And you said that. I even wrote that down in my notes that you really believe that we are all one and that
Mm-hmm.
what we're here to do is to figure out how to love each other.
It's one of the hardest things to do, right? If they're not in sync with you or have really strong emotions, and you're someone who's afraid of emotions or been
Yeah.
traumatized,
Yes.
or you have different political views.
True. Yes, that happens often, doesn't it? But the
So,
challenge comes from that person that's not easy to love. But there's a lot of reward that comes out of getting there. If you can get there and that's really full and rich.
and that's how kids get better, because their parents work on acceptance. And there's a lot of strategy. These aren't just principles and ideas we don't just give psychoeducation, we give skills
Yes.
to practice acceptance. What does acceptance sound like with words, and how does it look with body language, with behavior? And it's a skills deficit. What do you have to do? You have to practice it. It's not going to come naturally. It's not going to feel natural. These aren't words that so you just need to say it, do it frequently. Just like anything else you want to learn, you have to set your mind to it, practice it, get good at it.
Yeah. So you've been doing this for, you mentioned 20 years. Have you had any testimonials, any people that have come back after years of you working with them, like a long time ago, and they're like, thank you so much. This changed my life?
I have. It's just such a good feeling. I'm going to give a caveat. Someone who was born with big emotions will always have big emotions, right? That's a lifetime of a lot of pain.
Hmm.
It doesn't change, but you develop more capability. Like I've people want to kill themselves, and suddenly they don't feel that way anymore, and they're able to. Their life isn't in chaos, so they're able to find work, sustain work, have good relationships, have some DBT maintenance, from time to time.
Find something satisfying.
Yeah, it's Marsha's goal for patients was, how do I have a life that's worth living,
Hmm.
despite the fact that I have these big emotions that cause me to feel like I'm in hell. But it matters, right? And your life matters, and
Yeah.
nobody should suffer like that.
And coming to that realization for somebody is a really big moment when they do realize my life does matter and they're
Hmm.
coming out of that dark
Right.
time of their
I found
life.
purpose. I found love, connection, maybe spiritual awakening. Yeah, I love myself. But those are, again, skills you can practice to cultivate it.
Well, I think it's clear that you are definitely in the role that you intended for yourself with this lifetime. It's something that you're thriving at, and that speaks a lot because when you're in those roles, and it can be difficult, but for you, even though the difficulty is there, this is something that really feeds your soul, and you really
Hmm.
believe that everybody can improve.
Hmm.
No matter how dark it is,
Right.
improvement is there. So I think that's wonderful.
Yes. One day at a time, one success at a time, one moment at a time.
And there's a book in the works.
Yes, there is. My original orientation was in attachment theory and research. It's evolutionary based psychology, and attachment style outlasts temperament. So if there's a child who's a poor fit for a parent like that big emotion kid, even with like a parent who's averse to conflict, let's say, but can learn to cultivate safety
Hmm.
in the home and love.
Security.
Um, yeah, the child can develop secure attachment, and that protects against mental illness. And so, like even like a cranky temperament, as a child, let's say, as a teenager, it doesn't necessarily, last, right? But attachment style does. So it's really important to cultivate a safe environment at home, and a trusting and loving environment at home.
Okay, so this is what you're going to focus on for the book.
Hmm.
I hope that when you're ready to publish the book, you'll reach out and we can have
Oh,
another conversation
oh yeah.
and let the audience know it's ready and there for
Oh, that's exciting.
their
I
reading.
it's something that I really feel very, passionate about. So
Yeah.
just got to
Well,
keep working at it.
it'll happen.
Yeah. Thank you for having me on here. What a treat and pleasure. I
This has
love
been
like-minded
wonderful.
folks.
Yeah, no, I really feel that we were meant to meet, and even though it was in kind of a backwards kind of way, it worked out so nicely, and I'm really happy to know you. Thanks for being
You
here and
too.
talking with me and with my audience.
My pleasure.
If you're enjoying the podcast, you can show your support by leaving a rating and a review on your favorite podcast platform. You also can follow Dr. Williams' podcast on all social media platforms and subscribe on YouTube and by going to www.drwilliamspodcast.com. Deliberate creation is the key to living life satisfied, and that is my wish for all of you.